Hello, everyone. Today's video dives into a fascinating and highly debated topic. Can cinnamon lower blood pressure? This question has sparked interest among health enthusiasts, researchers, and medical professionals alike, as cinnamon, a common spice found in kitchens worldwide, is often touted for its potential health benefits. The discussion is complex, with studies showing mixed results and experts weighing in on both sides. To explore this thoroughly, the video presents a structured debate between two teams. Team A, which argues that cinnamon can indeed lower blood pressure and should be considered a helpful dietary addition, and Team B, which contends that the evidence is insufficient and that cinnamon should not be relied upon for managing blood pressure. The debate unfolds in a professional, engaging, and educational manner, covering scientific studies, mechanisms, safety concerns, and practical implications. Let's dive into the action as the two teams face off in a series of intense exchanges. The debate begins with opening statements, setting the stage for a clash of perspectives. Team A starts by highlighting cinnamon's historical use in traditional medicine. They note that cinnamon, derived from the bark of cinnamomum trees, has been valued for centuries in cultures worldwide for its purported health benefits. Team A emphasizes that modern research has begun to explore these claims, particularly regarding blood pressure. They cite a 2021 systematic review of 8 clinical trials involving 582 participants, which found that cinnamon supplementation led to a modest reduction in diastolic blood pressure, the pressure in arteries when the heart rests between beats. Team A argues that this effect, though small, is significant for individuals with mild hypertension, also known as high blood pressure. They also reference a 2021 study with 40 participants, which reported a moderate decrease in systolic blood pressure, the pressure during heartbeats. Team A suggests that cinnamon's bioactive compounds, such as cinnamaldehyde, may relax blood vessels, improving blood flow and reducing pressure. They conclude their opening by asserting that cinnamon, when used consistently, offers a safe, affordable, and accessible option to support blood pressure management alongside other lifestyle changes. Team B counters with a firm stance, arguing that the evidence for cinnamon's blood pressure-lowering effects is weak and inconclusive. They acknowledge cinnamon's cultural significance, but stress that traditional use does not equate to scientific validation. Team B points out that the National Center for Complementary and Integrative Health, NCCIH, states there is insufficient evidence to support cinnamon for any health condition, including hypertension. They critique the 2021 review cited by Team A, noting that the trials were small, with varying dosages and durations, making it difficult to draw definitive conclusions. Team B also highlights that the 2021 study with 40 participants lacked a robust control group, limiting its reliability. They argue that any reported reductions in blood pressure may be due to placebo effects or other confounding factors, such as participants' dietary changes during the studies. Team B concludes their opening by emphasizing that relying on cinnamon could give false hope to those with hypertension, potentially delaying proven treatments like medication or exercise. The first round of rebuttals intensifies as Team A challenges Team B's dismissal of the evidence. They argue that while individual studies may have limitations, the collective data from multiple trials suggest a consistent trend. Cinnamon supplementation tends to lower blood pressure, even if modestly. Team A introduces a 2020 meta-analysis of randomized controlled trials, which found that daily cinnamon doses of at least 2 grams for 8 weeks significantly reduced both systolic and diastolic blood pressure in adults. They stress that this analysis included diverse populations, strengthening its applicability. Team A also addresses Team B's placebo concern, noting that many studies use double-blind, placebo-controlled designs, minimizing bias. They propose that cinnamon's potential mechanism involves its antioxidant properties, which reduce oxidative stress, a known contributor to blood vessel damage and hypertension. Team A urges the audience to consider cinnamon as a complementary approach, not a replacement for medical treatment, and accuses Team B of overly conservative skepticism that ignores promising preliminary findings. Team B fires back, questioning the practical significance of cinnamon's effects. They argue that even if cinnamon reduces blood pressure by a few millimeters of mercury, as reported in the 2020 meta-analysis, this change is unlikely to make a meaningful difference for individuals with stage 1 or stage 2 hypertension, defined as blood pressure above 130/80 millimeters Hg. Team B references a 2021 double-blind, placebo-controlled trial in patients with stage 1 hypertension, which found no significant blood pressure reduction after cinnamon supplementation. They emphasize that inconsistencies across studies, such as differing cinnamon types, Ceylon versus Cassia, and dosages, create confusion for consumers. Team B also raises concerns about cinnamon's safety, pointing out that Cassia cinnamon contains coumarin, a compound that can harm the liver in high doses, especially for individuals with pre-existing liver conditions. They argue that promoting cinnamon without clear guidelines risks unintended health consequences. Team B accuses Team A of cherry-picking studies and oversimplifying a complex issue, urging caution until larger, well-designed trials provide clarity. The debate shifts to a deeper discussion of cinnamon's mechanisms, where both teams dig into the science. Team A elaborates on how cinnamon might influence blood pressure. They explain that cinnamaldehyde, a key compound in cinnamon, has vasorelaxant properties, meaning it helps blood vessels relax, reducing resistance to blood flow. Team A cites a 2024 study suggesting that cinnamaldehyde inhibits calcium channels in smooth muscle cells, preventing vessel constriction. They also highlight cinnamon's anti-inflammatory effects, noting that chronic inflammation can stiffen arteries, raising blood pressure. A 2021 review found that cinnamon reduced markers of inflammation, such as C-reactive protein, which Team A argues could indirectly support healthier blood pressure. They connect these mechanisms to broader cardiovascular benefits, referencing studies showing cinnamon's ability to lower blood lipids and improve insulin sensitivity, both of which are risk factors for hypertension. Team A concludes that these interconnected effects make cinnamon a promising tool for holistic heart health. Team B challenges the mechanistic claims, arguing that most evidence comes from animal or test tube studies, not humans. They point out that the 2024 study on cinnamaldehyde's calcium channel effects was conducted in rats, and its relevance to human physiology remains unproven. Team B also questions the inflammation argument, noting that while cinnamon may reduce certain markers, there's no direct evidence linking this to blood pressure reductions in humans. They cite a 2023 review stating that cinnamon's cardiovascular benefits are largely speculative due to limited human trials. Team B further argues that cinnamon's effects on insulin sensitivity, while promising for diabetes management, do not automatically translate to blood pressure control. They stress that hypertension is multifactorial, involving genetics, stress, and lifestyle factors, and no single food or spice can address it comprehensively. Team B accuses Team A of extrapolating beyond the data, creating an overly optimistic narrative that could mislead viewers. The debate takes a practical turn as the teams discuss how cinnamon might be used in daily life. Team A advocates for incorporating cinnamon into a heart-healthy diet, suggesting doses of 1 to 2 teaspoons daily, equivalent to 2 to 6 grams, based on study protocols. They propose sprinkling cinnamon on oatmeal, blending it into smoothies, or brewing it as tea, emphasizing its versatility and affordability. Team A references a 2025 article by dietitians who recommends cinnamon as a flavorful way to support blood pressure, especially when combined with a low-sodium diet and exercise. They argue that small, consistent dietary changes, like adding cinnamon, can compound over time to improve health outcomes. Team A also addresses safety, noting that Ceylon cinnamon, which has lower coumarin levels, is a safer choice for long-term use. They encourage consulting healthcare providers before starting supplements, particularly for those on medications, but maintain that culinary amounts pose minimal risk for most people. Team B counters that practical application is fraught with challenges. They argue that achieving therapeutic doses through food is difficult, as 2 grams of cinnamon is more than most people would naturally consume daily. Team B cites a 2025 study warning that cinnamon supplements, often used to reach study doses, are unregulated by the Food and Drug Administration (FDA), raising concerns about purity and potency. They reiterate the coumarin issue, noting that even small amounts of cassia cinnamon could accumulate over time, posing risks for sensitive individuals. Team B also questions the feasibility of long-term adherence, arguing that expecting people to consume cinnamon daily for 8 weeks or more, as studies suggest, is unrealistic for many. They accuse Team A of downplaying these barriers and promoting a one-size-fits-all approach that ignores individual health needs. Team B stresses that proven strategies, like the dietary approaches to stop hypertension, diet, offer more reliable results without the uncertainties of cinnamon. The debate reaches its climax as the teams address the broader implications of their positions. Team A argues that dismissing cinnamon outright ignores its potential to empower individuals, especially those with limited access to healthcare. They emphasize that hypertension disproportionately affects low-income communities, where affordable interventions like cinnamon could make a difference. Team A cites a 2024 review showing cinnamon's benefits in diverse populations, including those with type 2 diabetes, a group at higher risk for hypertension. They argue that even modest blood pressure reductions can lower cardiovascular risk over time, particularly when combined with other lifestyle changes. Team A accuses Team B of elitism, claiming their skepticism prioritizes perfect evidence over practical solutions. They conclude by urging viewers to consider cinnamon as part of a proactive, holistic approach to heart health, guided by medical advice. Team B responds passionately, arguing that promoting cinnamon without robust evidence risks public health. They warn that individuals might delay or forego proven treatments, like blood pressure medications, in favor of unverified remedies, leading to serious consequences. Team B references a 2025 case study of a patient who experienced liver issues after taking high-dose cinnamon supplements, underscoring the need for caution. They argue that healthcare disparities are better addressed through education and access to evidence-based interventions, not speculative dietary fixes. Team B accuses Team A of sensationalizing cinnamon's benefits, creating false hope that could erode trust in science. They conclude by advocating for a balanced approach. Enjoy cinnamon as a spice, but rely on established methods like medication, exercise, and a healthy diet for hypertension management. As the debate wraps up, both teams summarize their positions. Team A reiterates that cinnamon shows promise as a safe, accessible tool for supporting blood pressure, backed by emerging research and traditional wisdom. They encourage viewers to explore its potential under medical guidance, emphasizing its role in a broader heart-healthy lifestyle. Team B maintains that the evidence is too weak to justify cinnamon as a blood pressure remedy, urging viewers to prioritize proven strategies and approach supplements with skepticism. They acknowledge cinnamon's culinary value but caution against overstated health claims. The debate leaves viewers with a nuanced understanding of the topic, highlighting the importance of critical thinking and informed decision-making in health choices. In closing, the video reflects on the debate's key takeaway. Cinnamon's role in blood pressure management remains uncertain, but the discussion underscores the value of questioning health claims and seeking reliable evidence. Viewers are encouraged to consult healthcare providers before making dietary changes, especially for conditions like hypertension. The debate has shown that science is a work in progress, with new studies continually refining our understanding. By staying curious and informed, individuals can make empowered choices for their health. Thanks for watching this in-depth debate. If you found it informative, please give it a thumbs up, share it with friends, and subscribe to the channel for more educational content. Drop a comment below to share your thoughts on cinnamon and blood pressure or suggest topics for future debates. Let's keep the conversation going.